A massive new campaign to fight Zika around the world. The World Health Organization has announced a plan to devote $56 million to combating the virus through June. Half would come from the UN organization and the balance from individual member states and other donors. Brazil is the country hardest hit by Zika. CCTV's Paulo Cabral reports from Sao Paulo.
The resources that will be destined to fighting the Zika virus crisis all over the world, reportedly $56 million, will be used in two main axes of action. The first one is trying to understand what's happening. There are still many questions in the air, not that many answers. So this includes, for example, enhancing the surveillance of the Zika virus, following the patients and see what really happens to them, and trying to explain this connection between Zika virus and deformities in newborns. There are some people that still question if this is really a valid link. The other axis has to do with fighting the disease itself, and this includes fighting the mosquito, the Aedes aegypti, that carries the Zika virus and also the virus of the dengue fever, but also using this money to fast-track the development of a vaccine and of therapeutics to deal with the Zika virus infection. And also a part of this money should be used to treat the people that have been affected by the disease. For example, the babies with microcephaly that have already been born. It's not clear yet how much money Brazil will get for this, but it seems that it will be a large portion of the money, possibly the lion's share, because Brazil is the worst affected country by this crisis, both in the number of people infected by the Zika virus and also by the number of infants, of newborns being born with deformities. The Minister of Health say they are investigating 4,500 cases more or less, and more than 500 have already been confirmed. The world is also looking with much attention to Brazil. One evidence of this is that next week different health officials from different governments from around the world will come to Brazil, also with the Director General of the World Health Organization, Margaret Chan, for a visit to try to assess the situation and see what steps still could be taken. Paulo Cabral, CCTV, São Paulo.